Ange, why don't you just introduce yourself? Just say what position you are and what you're doing at the moment as a doctor, and then we can go from there.
Sure. I'm Angeline, and I am right now doing my BPT at the Austin. I'm an international medical graduate, so that's in a nutshell what's going on.
For sure. And I remember a few years ago when we bumped into each other. It was in your AMC exam times. I'm not sure if that was yeah, for part two. I think you were studying for. Bit of a journey to get over here. Do you want to just walk us through like how it was and how you got over here to work, and yeah, talk us through that journey?
100%. So yeah, when we met, I was actually preparing for part two, battling to through part two more, to be more precise. Anyway, so I came to Australia in 2011. So how it works is when you're an international medical graduate, you have to pass Australian Medical Council Part 1 and Part 2. So to work, you are eligible to work if you've got Part 1, which is the MCQ exam. You become eligible for limited registration, where you have to work under supervision. And with Part 2, you're eligible to get your general registration, which I'll talk about. So initially, when I came here, I started working within 2 weeks of getting to Australia before my AMCs as a in a non-clinical position as a medical officer in a middle insurance company that gathered medical data for the big insurance companies like TAL and AIA and AXA and all of them. So I did start working, and then while I was working, I sat my MCQs. And once I passed my MCQs, I started off as a GP, and then started the whole convoluted journey of trying to get through AMC Clinical, as some of your other guests have spoken about, as quite a tough exam. So working, and initially I was, because the exam was so tough, I thought, there was the other way of going where you could do your clinic, you could do your fellowship in GP, and then you could get your general registration that way. You didn't have to do the AMC clinical. But then there was an interruption in that because I was under a program that allowed IMGs to work in the metropolitan area. And then when the government changed, they scrapped that program. It was called special approved placement, where basically if the clinic showed that they couldn't find any other doctors that IMGs could give you an exemption from your moratorium, and then start working. So because of that, I was kind of cornered into going back to the hospital. But when I went to the hospitals, when I realized I prefer to be a hospitalist than rather than being a GP. I like working with people. As you can see, I love to talk. I love working around a lot of people, and that was when I did a bit of women's health, and then I came to psych because from where I come from, the psych training is quite minimal, and like you need to have a good solid psych training for any specialty that you decide to go to. It really comes in handy. And I see that a lot now when I'm working through my BPT. It comes really, it really really helps. That whole psych training and that way of how dealing with difficult patients or your communication skills and all that. Anyways, going through all that, there was a lot of fighting for the clinicals, and I was a bit lost as I knew I wanted to stay in the hospital. Didn't know where to go though, but one of my besties, who is a registrar who's doing his BPT at St. V's, he sat me one day and spoke to me for an hour. Basically sold BPT to me, and I was convinced that's what I want to do. I'm back in BPT after the exams are all done. It's tough, but I'm loving every bit of it. So I know I'm where I'm supposed to be. It took me a while, but we got there. Yeah, so that's a nutshell of the whole big convoluted journey.
No, it definitely sounds like it's had its like ups and downs, and it's by no means like a straightforward journey for anyone coming from whatever country. Where were you working beforehand, before you came to Australia, and how was that? What was that like?
So I worked as an intern. So in a very busy hospital in India. So I'm Sri Lankan by background, but I actually trained in India. I did my medical school in India because in Sri Lanka, if you studied in English, so basically if you did all your studies in English, which I did because we traveled a lot with my dad's line of work, you had to go overseas to do medical school. They wouldn't accept you into the local colleges, so they have that law. So I couldn't get into medical school there. So I had to go overseas, and India was closest to home, and that's the reason why I actually wasn't planning on moving anywhere. It was just because I met my husband who lives in Australia, so that's why I had to move here. So yeah, I trained in India. So right after I trained, I went to a very busy hospital um, for my internship. So once internship was over, I got married, moved here. So yeah, so didn't work in India. Yeah.
But you did your internship in India, correct?
Correct, correct. Yes, yes.
And how was that? I mean, just the 1 year in India, how does that compare to the Australian healthcare system? I've had a few messages from some people, and it seems a little bit chaotic. But what's your personal experience?
Chaotic is a bit of an understatement, I think. Lots of learning. Well, don't get me wrong. I worked with some of the most brilliant doctors there. Worked for a hospital called Christian Medical College in South India, which is very, very popular. Um, People would think that I was exaggerating, but this is how it actually goes. So you'll do your night shift, and you'd be up all night, very acutely ill patients, a big broad spectrum of. You'll see everything there. It's a very specialized hospital, so people travel from near and far to get treatment there. And then and how it works is you don't just hand over and walk away like you do here. You have to do the whole old fashioned traditional rounds where you go from bed to bed and you're talking about each patient, and there's consultants there are registrars there, everyone there, and you're basically staggering by the evening because you get to about it's even past lunchtime by the time you get home to go to sleep, um, after you've handed over your patient. So you know it's that intense. So you throw anything at people like me, it's like, oh, this is nothing. This is a piece of cake. This is a cakewalk shift. So it is quite intense. It is quite intense. I don't know how safe it is. That's a bit questionable, but that's the way it works there. I don't know if it's like that anymore. Maybe less now, but when I graduated, I feel like a dinosaur now thinking of when I graduated. Anyway, so it was quite intense. I remember, but the learning was unbelievable. It was inexplicable. The kind of learning that you had. It was quite intense. It was very, very, um, they were very firm with the way they did things. It was very old school, very military style. But we got a lot of learning there. Yeah, so it was intense.
Yeah, I don't know how you were able to function after like a night shift, and then
I don't even know how I function. Looking back at it now, I honestly don't know how I function.
like I barely get through a handover to like the morning registrars, and then to let alone think that you need to, go on a round with consultants and everyone who are going to be quizzing you, and you're like, man, I just need to go to sleep.
I'm like, dude, I have no idea. I'm half asleep already. I have no idea. So yeah, it's like this traditional rounds. You go bed to bed. How it was before. Yeah. So thinking of it now, I don't know how I managed.
Exactly, but you got here. So when did you do the AMC part one? Because as you said, like you need to do that before you actually get a job here and start work.
Yeah, so 2013, it's been a while. So I did my MCQs in 2013. And for a good 2, 3 years, I didn't even attempt the exam because I thought, okay, because back then you could do GP training as what you called an independent trainee. So you would work for 4 years, and if your supervisor signed you off, you would be eligible to sit the exam. So it was only after about 3 years of passing did I even start preparing for the clinicals. And I'm not ashamed to say it took me a couple of tries. I wear it like a badge of honor, because I'm proof that if I can do it, everyone else can. Um, you know,
But where were you in like when we were doing the AMC part one? Were you still in India or were you already here?
no, no, no. I was here. I was here. I was in Australia. I was working in a non-clinical position, as I said, in an insurance, insurance company. So I was working at the same time preparing for the MCQs. So MCQs is all right. It's not as tough as a clinical, but the MCQs is tough too. Yeah.
It's a big step though. You've just like graduated medical school, you've done your internship, and then you've met your husband, well, your now husband, and come across to Australia and gone almost out of the medical profession whilst sort of trying to get a job here. Like it's a big change, hey?
100%. 100%. And we come from a culture where we don't even work until, we graduate, or, we don't have the system where, you work as teenagers and you know what work culture is like, you don't know any of that. So, you're this kid with, born with a silver spoon, and suddenly you're just, working day and night to, because the exam fees are really, really expensive. And we were just starting our life at that time, me and my husband, and we were too proud to ask our families for help. So it was tough. It was tough, yeah.
Exactly. And you've obviously got is it one child or you have more than one child now?
I've got two. I've got two. I've got a 7-year-old and a 4-year-old going on to 16. So yeah, yeah.
And when did they come into the picture when you were studying and working, and how are you managing that, all at the same time?
Oh, it was hard. So my eldest, I had him right when I was a GP. So I was going, okay, this is you have we knew we wanted to have kids. We were ready. So my eldest I had when I was a GP. So it was, and I had hyperemesis with both the kids, and it was just horrendous. And then my youngest was, I was in ONG at that time, working nights and crazy hours, and so I was in ONG at that time, and then she was born, and a week or two later, COVID hit. So yeah, so I had to get back to work 3 months earlier than planned because they wanted all hands on deck. And yeah, we didn't know what the virus was like, and I was still nursing her, and it was a bit of a scary position, but yeah. So it was hard. I mean, I hadn't passed the clinical exam until my youngest was a year old, and yeah, so it was really tough studying with them. But they know they're so used to seeing mum study that they know when to stop.
And so just to clarify, you did this like other job in the insurance before you started working, you passed the AMC, and then your first job in Australia was as a GP or at the hospital?
Correct. As the GP, as a GP, yeah.
And then you worked for a GP, well, you worked as a GP for how many years before you went into the hospital?
A month or two shy of 3 years. So it was, yeah, 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 yeah. So it was a big change.
Yeah, and how's the GP life compared to, what it's like in India or in Sri Lanka as well? Because I presume like you would have been to the GP, overseas, well, in your home country. Like, is it much of a different scenario?
I think it's very similar in the sense that being a GP in both places, you do become an integral part of the family. They actually treat you like family. That's something that's not any different in Sri Lanka or in Australia. I think it's very similar. I think GP now is changing. In Sri Lanka, it was initially considered someone who had no fellowship, just a just MBBS and out of medical school, and they do GP work. But now they've got fellowships for family medicine as well. So I don't think it's any different. It's very similar.
Got you. And the role as a GP here was like almost like an unaccredited registrar. Is that like how you describe it? Yeah. Okay.
Very similar. Yes, that's right. Yeah.
Got you. And so what stage are you at now with this BPT? Have you sat any exams like the written or done the clinical or?
Not yet. Yeah, I have a year and a half to two until things get a bit chaotic. So the good thing about BPT is the right after 3 years you have your written, and then you have your clinicals, and then after that is advanced training, whatever you get chosen for, and then you don't have any exams after that. So yeah, I'm grateful for that.
What are you thinking about? Which like advanced training pathway you are considering?
When you and I were working together, I mentioned one, and you said, "Ange, come on, aim high, Ange."
Did I?
This is I'm not going to mention that specialty in case I do end up there. Um, You were like, yeah, you don't want to do that. And then I was like, oh, yeah, I don't want to do that. I
Oh
love
my god, I
cardiology.
can't believe I was so judgmental.
No, you weren't. You weren't. To be honest, you weren't. We'll talk about that, off
Yeah,
the record. But you did mention a very valid point, but it was not judgmental at all. But I love cardiology. I've worked very closely with in hospital in the home with Associate Professor Mark Horrigan, who, um, and I met so many other amazing cardiologists, Dr. James Thurl and Dr. Julian Yo, and they all kind of, you know, I would say inspired me to become a cardiologist. And, they would keep drumming it into me. Ange, I think you'd be great at cardiology. You've got that personality. But I love the way the heart works, and I love the whole, the whole speciality as such, and I love the culture in the team. And so cardiology is what I want to very, very, very competitive. So I'm hoping for the best. We'll see.
yeah, for sure. I know a few people who are sort of angling towards cardiology, and it seems like research is almost like a prerequisite.
100%. So I've done a couple, and I'm in the process of writing it up. And I think it's mostly about research at this point in time. The more, the better. They say you have to come in with at least 2 to 3 papers when you come for the interview. So that's, I mean, I mean, there's one side of argument that debate that, oh, doing research doesn't make you a better doctor, but it's just the way it is. I mean, that's how it works, anyways.
Yeah, I think the more competitive the specialty, you need to find a way to, narrow the bottleneck. And research is one of those good it's a good deciding factor because it's tricky to do. It takes time outside of work. It's not the easiest thing to get all sorted. So it's a good barrier to entry.
No, no, no. That's what I think. That's the factor. That's why they kind of integrate this into it. So
And like coming across, like, you graduated from Indian medical school, and you're moving your whole life from Sri Lanka. Did you have anyone else who was like in the process with you, like any other fellow IMGs who were like moving across that you know of?
oh yeah, definitely, definitely. So I had my cousin who kind of paved the way, and she did mentally prepare me, for this, and I met a lot of IMGs when I went for the bridging courses, who are in you know who are in situations very similar to mine, and they've done the same. They've gotten they come here for their partners, or they just decided so the good thing was I was surrounded by people who were in the same situation, and the same path. So yeah, it was a way to it was support you needed, isn't it? You needed that like-minded people around you. You needed people rooting for you. You need to kind of be around people who are in the same situation to understand, because I'm sure you know about it because you would have heard us ranting on about AMC while we were working together. But many local graduates or doctors from the US or the UK who haven't had to sit the AMC don't really understand it, and there's a very judgmental aspect to it. About, I mean, the pass rate is less than some 8% at the moment, and I know they don't understand it, and there's a lot of, oh, they should have done the exam this way, they should have done the exam that way, and maybe prepared this way and prepared that way, and a lot of judgment and a lot of unsolicited advice, I guess. But um, it yeah, like I said, it's a very hard exam. And it kind of turns your whole world around. It takes a toll on your mental health. It plays with your self identity. You start doubting yourself when you have an exam. You've done so well and sailed, through things, and then suddenly you come here and you've never seen failure, and you fall repeatedly. It's hard.
Yeah, no, it's a big thing, right? The longer you go in your like medical journey, AMC or other exams, like you'll have some exams that you don't get through, and it's like for some of these people, it's the first time they're dealing with failing an exam. It's interesting to see how they respond.
Exactly. And it's all about resilience in the world today. I keep telling my kids, you can be, you know, as smart as you are, as talented as you are, but if you don't have that resilience factor, like grit. You know, you're not gonna succeed in life because like that's how life works, isn't it? You can't keep winning. You will lose at sometimes, you will fail at sometimes. It's all about getting up, dusting yourself off, and you just keep moving. When the going gets tough, the tough gets going, hey?
Wow, I feel inspired at the moment. Have you considered writing a book, Ange? I reckon I'd buy it.
I probably should. I think I probably should. Um, no, the thing is, the thing is, Harry, I've met so many other, doctors. When you're in that situation, obviously, your problem seems to be the biggest of all, right? Everyone's like that. But after I've actually crossed that hurdle, and I meet a lot of other IMGs, and especially now where Victorian healthcare system's going through this crisis where we don't have funding. We don't have enough doctors, but we just don't have enough funding to get more doctors. You hear all these stories, and I'm thinking to myself, it breaks my heart. I met a doctor the other day. That's when you start counting your blessings and you go, oh, maybe I wasn't that bad off. Like I met another IMG, and she's from a very similar culture as mine, and she's just in her early 30s, and she was telling me we were doing night shift together. So she's now there's a different pathway where they can do PLAB instead of AMC, and then you can get yourself registered. It used to never be the case. You used to work. You have to you had to work in the UK for a year, but now you can do PLAB 1, PLAB 2, and it's comparable. So you can just get your registration and work. So she was planning to do that, and she was telling me how her husband and his family were actually pressurizing her to have a child. And she was telling me, "How can I, with all this going on, how can I?" And I felt so privileged. I was like, my husband never gave me that grief. My in-laws or my parents, they were so supportive. They said, "Look, you do what you need to do. We're not in a race. You do what you have to do." And then you hear all these stories, and then I met another IMG. He's from Malaysia, 7+ years psych training back home from Malaysia. Moved to New Zealand with his family, with his young family. He's got a 6-year-old child, and then couldn't do the exams there because apparently the New Zealand exams are worse in the sense they have them only twice a year, and there are people in a backlog waiting to sit the exams. Comes here struggling with the AMC clinical again. Can't work. Now he's like, I've run out of the money that I came with. I don't know what to do. It's just so heartbreaking. And he was talking to me the other day, and he's like, "Oh, I think the, I think the doctors don't want me to keep," because he keeps emailing them, right, his CV and cover letter, and he says, "Oh, I think they're very subtly telling me to stop. What do I do?" And I said, "Well, don't get on their bad books. Just let it go." But it's just that I can feel that pain because I've been there and I know what it's like. All I can tell them is, as cliche as it sounds, this too will pass. You will get there, but it's a matter of time. We just don't know when. You know what I mean?
Yeah. It's so tricky to, have all this change and then, try to sit all these exams, but then also keep up with like your actual like real life outside of work. I was talking to a couple of other IMGs, one of which was like a mum of three, and it's like, how do you balance like, doing what you want with your actual life versus your work? I mean, it's different for us, right? I don't have to worry about when I have to have kids, do I have mat leave? Can I even have mat leave if I'm not even working or whatever? Like it's very tricky.
Yeah, it is. It is. Some of the other doctors that work with me, they ask me because most of them don't have kids. "Oh, how do you do it?" I said, "Don't even ask me. I don't know how I do it. So let's not even start." Um, their kids are sick. Like last week, my youngest was down with influenza, and I was sick, and then juggling that, and then you've got presentations for work, and you've got your assessments to do, and you've got 14-hour shifts to sort out, and well, yeah, you got to do what you got to do. Hey, end of the day.
It's crazy. I am working at a health service this year, and it's like there's a lot of IMGs who come and they are often older than me. They even though I'm like the registrar and they're the residents, they already have like a family. They already have like their like life set up, and I'm like, how do you even like fitting this all in? Like it's crazy to even conceive that idea. To be honest.
Yeah, it is hard. I mean, IMGs have it tough, but a lot of them have perseverance and they power through it and they do well. And yeah, I guess, yeah.
You just make it work in the end. But like before you decided to come over to Australia, like I know there's like a lot of people from like India, from Sri Lanka, from Malaysia as well who come across. Did you do like an observership or think about doing something like that? I know that's an option for some people.
I did, like I said, the other IMG I was talking to you about is doing an observership with us. I did consider it, but I just got into the healthcare system quite easily. I was very lucky. So the minute I passed the MCQs and I applied, I got a job. So I did consider it. I did consider it, but I didn't need to at that point in time because I started working. But it was like throwing. I was pretty much flung into the deep end right after the MCQs. I had an amazing supervisor with my GP work, but it was a very busy practice, and I had to do a lot of self-learning, even though he supported me through it, and he would do teaching whenever he could, but we were really stuck for time. So yeah, didn't I mean, it's a great idea. I think IMGs, I always do recommend that they do observerships. I do coach them for observership interviews whenever I can, because it's good exposure. You get to meet people. They get to see you as a person rather than a applicant when you apply for a job. Hey, so yeah, it's a good idea.
Do you think it improves your chance at getting a job after you've done the AMC Part 1, or it's just much of a muchness and it's just good for exposure?
I think it does improve your chances, provided you're a good observer. So there are observers that just stick around, just watching, and they don't really create an impression. If you create an impression and you show them that you're willing to put in the work, definitely consultants are going to notice you. Definitely registrars are going to put in a word for you. I mean, we've done it before. I've put in a word for an observer who's come and gone up and beyond. It's a great way, but they have to I guess use it in the right way. If they're just coming in just for the sake of it to put something down on their CV, it doesn't really help.
Yeah. And do you want to just quickly explain what the observership is for if someone's listening and they have no idea what it is or have never heard of it?
Absolutely. So being an observer is basically you join a team in a hospital, but you don't have working rights, so you're not allowed to write up notes. You're not allowed to prescribe. You're not allowed to. I mean, you could do basically your rights are whatever a medical student has, pretty much. You could probably take a history. You could do an examination with supervision, but it's all with supervision. Um, so you're very limited to what you can do. I think some hospitals don't give you access to the system as well. Some do, some don't. But you can't write up notes. You can't. You have to get them signed off. So you have very limited. Um, you're not eligible to do all that, but at least you can join grand rounds or rounds, and you could probably draw blood if someone was supervising you. But some hospitals don't allow it. You can take a history. You can do a physical examination. You can attend the teachings that the hospital provides. Yeah,
Got you, got you. So essentially, just like either it's like work experience, but sort of like being a medical student again, really.
pretty much, pretty much. Yeah, it's but you do what medical students do. There's yeah, pretty much the same. Yeah,
And how long does it last for? Like, how long does someone need to spend to have completed an observership? You know.
I think it depends again from hospital to hospital. It could be a month. It could extend to 3 months. I think it's not more than that. It's not more than a term. But usually it's just a month or two. Um, Austin has a formal observership program that they run, which is great. They have an amazing IMG supervisor there. And I think she's part of PMCV now. She's phenomenal. So she set up this IMG. They have a formal program where they attend teachings and they go for things like that. So it's, I think, maximum of a term. a month to a term.
Got you. And where does someone like find, observerships for different hospitals in Australia? Is there like a centralized sort of application process, or you just apply hospital to hospital?
I think it differs. Like, for example, Monash, Austin have formal programs which they advertise on their career website. Some hospitals don't have a formal one. I guess you just write to the hospital, you write to workforce, your expression of interest, you put that in, and then they get back to you with all the information and they get you to come in. But certain hospitals like the Austin and the Monash, they have this program where it's advertised on the career website and you can just apply, and then you have a formal interview process, and you get through the interviews and you go into the program. Yeah,
But is there some sort of like website that shows you like, say, hospitals in Queensland that have an observership or hospitals in WA?
that would be amazing, but it doesn't. Unfortunately, no. There's no centralized system for each state. I guess you have to list out the hospitals in each state and kind of go into their career website and see what they have. Not all of them. Um, you can't have that. That would be great, wouldn't it? If they have this centralized system.
Yeah, we should make one, Ange, to be honest. Let's make one.
There we go. No, yeah, well, maybe we should. We should. And that would make things so much easier, wouldn't it?
Mm, yeah, for sure, for sure. Yeah, I feel like the lack of like information clarity for someone trying to move across from a different country to Australia is kind of frustrating. And then also to like touch on the fact that this AMC exam. I mean, we've spoken about it before, but I mean, I didn't have to do the same AMC exam. It seems a little bit interesting if you compare it to the US, where you have to sit the USMLE, they have to sit the USMLE.
It's well standardized because of that, isn't it? And they have a course. They have the Kaplan course. I remember one of my besties. She's a geriatrician now in the US, but she was trying to get me to move there at that time. And they have the Kaplan course. You do the Kaplan course. They tell you exactly what they want you to know, what they expect from you. You follow the guidelines. You do the exam well. That's it. You pass. But yeah, so it's hard. It's hard. If you don't have that standardized system. They say AMC advises that it is an intern level exam, but if everyone could sit, you know, the same exam, then you would know, isn't it?
Yeah. I remember, I think I was sitting the AMC, well, a version of the AMC for the local grads in like MD4, and which is like the final year of med school for us. And like that exam is pretty straightforward. Everyone passes pretty much. But some of the practice questions might have been from the actual AMC that IMG sit, and I was like, "Damn, like these are tricky. I don't think I would like." I was like almost freaking out a little bit, you know?
They're tricky. I remember when I was studying, I mean, that's probably one of the old questions. They used to have the scaphoid fracture case where the x ray would be normal and they'll ask you, what else would you like to do? And they won't give it to you unless you tell them. So if you say, oh, I'd like to get a CT scan, that's when they'll give you the CT of the end and you'll see a scaphoid fracture there. So it's quite tricky, and then I think it's all about. So how the AMC works is I'm not sure if it's the same with you guys, but you have 16 stations, out of which two are pilot questions and 14 are scored. So there'll be a mix of psych, there'll be a mix of gen med, GP, emergency, ONG, pediatrics. And then they have a screen outside the room. You read the question for a minute or two. I don't remember now. A minute or two. You go in. You can't write anything while you're reading the question. You can't take notes. Go in. The question's still there on the screen, but you've got all those tasks that you need to finish in there. The bell rings, the bell rings. You need to get out. So you need to finish all those tasks during that allocated time, and then there's an examiner sitting there, um, invigilating, and then you have a role player as your patient. So it could be a physical examination station, it could be a history station, it could be a counseling station. So it's all that nerves, isn't it? It's all that nerves, and I even now talking about it, that particular ring that they ring, the bell that they ring, gives me PTSD. Thinking about that whole noise that comes out, when you it's time for you to stop. So it's intense. But I guess that's the life of a doctor. Hey,
It is a little bit. We don't do that. So we don't do the AMC Part 2 sort of version. We have Oskies throughout the year, which is like, I guess, we might have, anywhere from like 4 to 8 or something, whatever it is. And we just rock up on the day, do those Oskies, which are just, well, when I was in fourth year and third year, they transitioned after COVID to just pass fail. So it's just like you just have to pass the station and you get through. Um, but for the AMC part for like local grads, it's just the multi choice exam. It's sort of like that part one AMC, but easy version of it.
it's a hard exam, but yeah, we'll see. We'll hopefully at some point in time things change. We can only hope for the best. Yeah.
Yeah, it'd be nice to see in the future that it like sort of gets standardized across the board so that local grads and international grads do the same exam and then they can actually just, have a whole standardized process. So if you're a doctor, you know what level of intelligence, you're at or
100%. 100% in an ideal world, isn't it? Like, it's a wonder, isn't it? Now, I've got BPT seniors who who've struggled with the AMC, but they passed BPT at one go. In one go, BPT is done. So you know what I mean? It's then that's when you start questioning, because I remember it's really sad. I remember when there was a petition going on about the low pass rate when I was studying for the exams. There was a friend of mine, her partner, who's nothing to do with academics. I don't mean it in a judgmental way. I mean they don't really understand the whole process of the things that we go through. And when he was like, he comments under the petition going, but this shows that we're not getting good doctors in Australia, isn't it? If the pass rate is so low, that means the doctors sitting the exam don't know what they're doing. And I'm thinking, that's not the case. These same doctors, they pass the fellowship in one go, the GP fellowship, they pass the BPT exams in one go, they pass the psych exams without a problem. Why is that? Is my question.
it'd be interesting to actually get the local grads to sit the AMC exam that the IMGs sit and see how they fared. Probably pretty similar. If not, IMGs might win, to be honest.
It's really sad that you say that, Harry, because I know a lot of doctors who actually are brilliant doctors. I've seen the way they answer the questions and how well they know the material. When you go to sit the exam and you do role plays and you're studying together, and these doctors fail. A lot of them. There's a friend of mine who's been trying to sit this exam for like 6 years now, um, and she's lucky. She actually took a break, went into a sonographer role. They're trained to be a sonographer, and then she went to Bairnsdale, but then she got to know the doctors there in Bairnsdale while she was working, and now she's been offered an internship and she's doing really well. And then there's another friend of mine who's actually moving to the US because she can't do it anymore. Um, so it is, yeah, it would be interesting if we could see that.
I know that there's an alternative to the part two exam that you can get signed off with, like a work based assessment. Is that like common? Because I was looking into it before. I don't think, many hospitals offer it and it's pretty select and few and far between.
Exactly, exactly. So when I moved to Australia, Monash, Shepparton, I think those two hospitals, very limited positions. They have a criteria that you have to have been an employee of that particular health center for at least 6 months, or some of them 3 months. And then Shepparton pulled out, and now Latrobe Regional, Mildura has it, Monash still has it, and I think Verity Mercy's in the process. I think they've been wanting to get it, but it's jumping through a lot of hoops as well from the hospital perspective. Very limited position.
Do you want to just explain it as well? Do you want to explain what the work based assessment is? Yeah.
Oh, sure, sure, sure. So the work-based assessment basically, rather than it's an alternative to the clinical exam. So you just basically have these assessments that you have to work yourself through and get a consultant to sign off. And I believe it's consultants who are accredited with AMC work based assessment. They're consultants who are part of it. So once they sign it off, normally they say the program's about a year, but I've heard from candidates that if they're quite keen, they could finish it up even within 6 months, and then you submit it. Once you've submitted it to AMC, they give you your general registration. So what I've heard is majority of almost 99% pass out work, pass the WBA. Very few exemptions. I've seen cases I've seen where they haven't completed the WBA successfully, but it's a great alternative, but it's very limited spots.
Yeah. And so instead of doing this AMC Part 2, you can essentially get that signed off and then get your general registration and then go and do whatever you want as a doctor here, which is pretty good.
Correct. And then, yeah, exactly. And even PLAB, that's another alternative I was talking to you about that I think it's a recent thing that they've started.
Yeah. So is that the UK? Is that the UK version of the exam? Yeah.
Yes, yes. So I remember there were doctors when I was studying for the exam trying to inquire if that was possible, where they could do the PLAB or the USMLE if they've done that and it's an equivalent. I mean, can we not convert it? So they used to do that with the New Zealand exams. So if you do the New Zealand exams, of course, you don't need to do the AMCs. But what APRA said at that time, which is the Health Practitioners Board, was that you cannot apply that way unless you've worked for a year in the UK. But now they're accepting part one and part two as an equivalent to AMC. So that's another path now that you have that we didn't have. So that's a new pathway, which I'm so glad that they have because the PLAP exam seems to have a better pass rate than, AMC at this stage.
Is it like both? Is there 2 parts to this PLAB, like PLAB 1 and 2, like
Yes, true. It's very similar. It's the MCQs and then you have the clinical.
but it seems like a bit more like there's more congruence between the material that you study or the way that you study for part 1 and 2 and the mark.
Even with BPT, yeah, exactly. Even with BPT, the MRCP, we use a lot of the MRCP material. So I guess, like you said, it's very congruent. So, but I guess I don't know when maybe at some point USMLE would become the same. They would accept USMLE as well because they do accept Canadian and American doctors. They don't need to do AMC to work in Australia to have working rights in Australia. Yeah, so maybe
Yeah, because I think it's pretty much the UK and then the US that can just come straight across, right? Is there any other countries that fall under that or
no. So it's Canada, US, United Kingdom. So Irish doctors, doctors from the Welsh doctors, Scottish, and the British doctors. I mean, basically the UK doctors can come without the exam.
yeah, got you, got you. And do many people like the hospital that you're at in India, you did your internship. After that, is there many people staying or are they all sort of branching off to US or UK or Australia?
Majority is US and UK. Majority, but there are doctors. I mean, I've had batchmates who've actually stayed and they're doing really, really well. Yeah, most of them. I would say most of them. I think have a family who are doctors there, who have their own hospitals, private hospitals, and majority of them stay back. Yeah,
Yeah, got you. But is there a feeling that like the health systems are better like in the US or the pay is better or like or Australia or Canada or what's the
I think pay wise, they say Australia is better. That's what I've heard. UK, of course, has as in there's no talking about UK right now. Yeah, it's just so unfair. The amount that UK doctors put in and what they reap is just ridiculous. Um, but I guess with US, they don't really. What I've heard from other doctors, I may be wrong. Don't quote me on this, but what I've heard from other doctors who've actually moved from the US, and when you talk to them about why they moved to Australia, because the opportunities are much more, right? Specializing opportunities are much more, but they don't have a good work life balance, is what I've heard from people. They said yes, you may be able to earn more, but you basically have to sell your soul to the devil because you don't have any time to yourself. It's absolutely really, really bad hours, and yeah, it's hard. It's hard.
Yeah, I'm trying to think of like a place that has better work-life balance compared to Australia. Like I know maybe some like I think it was like Sweden or
Some of the European countries I've heard, Norway, Sweden, Switzerland's pretty good as well, I've heard. But, I don't know any doctors that work here. Most of my friends are either in the UK or the US. Yeah, but I've heard that they're pretty good with work life balance. They're better than us.
yeah. And do you have like many friends back home or in India who are like wanting to specialize that after they specialize they want to come across? Because I know you can just do that and come across after you've actually fully qualified. Yeah.
I don't have any friends because they're living the life, right? They don't want to come here, cook by themselves, clean by themselves. They've got a cleaner, they've got a cook, they've got a chauffeur. They have a big house. Living the dream. So most of them don't want to once they specialize. There are a few doctors who've done it. I know a couple of doctors when I was working in ONG where they've specialized there and they've got it comparable here and they've moved here. But none of my friends, I don't think they ever want to move. They go to the US to do their fellowship and, some of their certifications, and then they come back. They don't want to go.
Yeah. But it's like it's my understanding that if you do that and if you were to specialize in your home country and then come across, you almost bypass all this AMC process, right?
So you go into the specialist pathway, but it becomes quite difficult. Right. In Sri Lanka, I know that Sri Lanka, because it's so centralized, most of the specialist colleges are so centralized, it's quite easy to get comparable. Where what it basically means is they work here as a registrar for a certain amount of years, and then they're consultant once their supervisor signed them off. But I know that some other countries, like some African countries, some Indian universities, do struggle with the specialist colleges because some of their colleges are not deemed comparable. So yeah, it gets a bit tricky. Yeah, but like you said, you do bypass the AMCs and all that drama.
Yeah. And one question I always keep getting, like people will just send me messages or leave comments on videos, is like they worry about IMGs coming across and then can they specialize or can they, get into their training programs? Like, of course, once they have general registration, they can.
But then it's the reality of certain colleges not accepting IMGs at all. That's a reality, hey, Harry, because I've had people messaging me and going, oh, what about specialization? Do you get to do surgery? Do you get to do ONG? And I said, well, let me be very honest with you. I'm going to be very real here. Don't even come here. If you want to do surgery, you want to do ONG, you're better off in the US. I don't know about the UK, but because because the demand is so high, which I don't blame them for. I guess the demand is so high that preference goes to the local graduates first. That IMGs can't stand a chance getting in from the beginning. I mean, physician college, the College of Psychiatry, GP college, they're all very IMG friendly. They do take IMGs in for the program, but the more competitive specialties like the surgical specialties won't.
Yeah. On paper, it's like there's no specific barriers for IMGs, but like what you're saying, sort of like anecdotally.
But the realistic thing is, it's hard, isn't it? You and I both know that it's hard as it is for local graduates, because I was talking to one of our hepatobiliary registrars the other day, and he was telling me, and I've had two goes. He's a local graduate, right? He's like, I've got two goes and I've failed both goes. I've got one more. I don't know what's going to happen. And I'm thinking, this is ridiculous. It's a hardworking registrar sitting there all night, working. And I mean, I guess that's a surgical specialty, right? And you see orthopedics. I was talking to another Persian IMG who was aiming at orthopedics. I mean, you and I know he's not going to get in, right? And because orthopedics is so competitive, it's like the king of all, all the or the surgical departments in the sense when it comes to the demand that it has. Um, on paper, like you're right, there's nothing to say that IMGs can't apply and won't be eligible, but the truth is you're not going to get in.
Have you heard of any like success stories with IMGs?
One, and they talk about her like she's some urban legend. Um, there was one particular doctor who apparently got in through the northern, who's an IMG, but she was phenomenal. She put herself out there. She would go for every meeting, meet all the panel members, befriend them, and you know, basically she wasn't a candidate when her application went through. They all knew her, but she was the one who went against all odds. I guess nothing's impossible, but it's hard.
Yeah, got you. I feel like, yeah, as you said, I see a lot of IMGs in psych and in GP and also BPT as well. Um, yeah, I'm not sure. Yeah, it'd be interesting to get some numbers on how many people actually
Yeah,
specialize.
and you're doing urology, is that right, Harry?
Yeah, that's what I'm interested in.
How are you liking it? Let's do a bit of a role switching. How are you liking it?
It's good fun. It's good fun. So yeah, just first year regging, it's certainly like, a step up from being a resident, but I love it, It's awesome. And did a bit of urology this year. I'll do some urology to finish off this year as well. And yeah,
Is that what you're aiming at? Oh, nice, nice. And you'll be putting in your application next year or the year after, or what are you planning to do?
I'll take a year off next year, do a bit of research, and then uh, get some points up, just polish up the application.
Yeah, that's good. That's cool. And tell me now that we've switched roles a bit. Tell me about about the whole motive behind your podcasts and your videos. I mean, it's a great initiative, right? I want to hear what brought that interest.
What brought it? Oh, well, I mean, I it's almost just I think it's just been over a year since I started doing everything. I feel like it was born out of like a frustration of like no one really supplying all that information. So this whole thing has just been like I'm talking to myself a few years back and like there's like a billion people, well, not a billion people, but like there's a lot of people who are probably in my shoes who probably had the same questions I had and still have. So that's all I'm sort of doing.
It's amazing. Amazing. It's amazing. I mean, when you reached out to me and I thought this is such a great initiative because I remember when you came as a psych intern, you were psych wasn't really a thing for you. You'd made it very clear to us when you walked in. You said, "I'm a surgical crit care kind of guy. I'm just here to get this all out of the way." But then I guess you heard a lot of our stories, and you heard a lot. I mean, we did the place that we worked in was a great environment, and we all really sat and spoke a lot about our journeys. And I wasn't surprised when I heard that when you reached out to me and they said, "Hey, Ange, I do this, and would you like to be a part of it?" Because I knew that you were quite intrigued when we used to talk about this whole thing. You used to always you're quite intrigued. You were actually quite shocked with the AMC, the whole process. I remember when we were talking about it, and yeah, it's great. I think we need to get the information out there, and we have to help each other. That's what it is about, isn't it? No one's going to come forward unless we help each other and try to help each other out. In this, it's a difficult field, and then like you said, there's not much information out there.
Yeah, 100%. And it's whatever information is out there is just not distilled. And I don't know, I thought that yeah, you can just spend a little bit of time, learn how to video edit, learn how to film and figure out all this other stuff.
So cool, so cool.
But I thought at the end of the day, if nothing comes of it, it's a new skill regardless, which would be pretty cool. And then you can like leave it, as just information for people to use. And
No, you're doing a great job. You need to pursue. I know you. I mean, even though you tell me, "Oh, I don't juggle as much as you guys do," or anything like that, it's a lot. Being a urology, Reg, I know it's quite an intense job, and it's really amazing of you, Harry, to actually not go, hey, I'm comfortable where I'm at, where I am, and it doesn't matter. But to invite IMGs and say, what can they do, and how can we help, and what can we do? It's a great thing. I mean, it's a great thing. I mean, yeah, that's how we bring about change, isn't it?
100%. And there's so many IMGs who just like want like information, who just like want to know like how it actually works, transition and stuff. So
Not many of them even know they can go into other colleges. They think GP is the only way to go. A lot of them don't know. I didn't know. I didn't know. I didn't know that physician training was so IMG friendly when it comes to intake. I just thought if you come here, you can work as a GP, and that's about it. So it's a lack of information. You're right.
100%. Andrew might we might switch the roles back to me being the interviewer. But I mean, put me out of my comfort zone. It's great. I don't know how I'd go being like an interviewee, but yeah, interesting. What would your piece of advice be for someone who's maybe they're in India, maybe they're in Sri Lanka or some other country who's wanting to come across? Maybe they do have some passion to do like ENT or some really specialist surgical pathway. But yeah, what would your advice be to them? How would you go about it? And even if they've been through like a little bit of failure, maybe they've had the AMC and they've had a few attempts and they haven't got through. Yeah, what would you say to that person?
So first of all, what I tell people who do IMGs who are looking into starting AMC, their journey with AMC, try and finish the MCQ and clinicals before you come into the workforce. As hard as that sounds, I know it's difficult. I was in that position when people told me to do the same. I was in a financial difficulty as well because it was just me and my husband, and we were just starting up our life, and we really, we were just too proud to ask for help. But if you have family who can help, take it. Don't be proud about it. Just take all the help you need, ask for it, and then you can always repay them. You'll be in a position to repay them and all that. You will be fine. But if you can, but I know it's not feasible for everyone. I know it's hard. So MCQs, the clinical exam is tough. Join a good bridging program. Surround yourself with positivity. There's enough negativity around the exam. Be around like minded people who are going through the same journey. You'll hear a lot of people say, "Oh, I passed in the first attempt," and it becomes this bar, this, standard people set themselves. And if you fail, it doesn't matter. You're not a failure. You're nothing less than you're not a less of a doctor, right? This is something that I want people to drum into their heads. This is just an exam. It doesn't judge you as a doctor. It doesn't judge your empathy. It doesn't judge your knowledge. It is just a day, and then a day to assess your year's worth of experience or trading. So go sit it like you don't. Nothing depends on it, and no matter how many times you fail, keep going. I'm an example. I pushed through. I was ready to give up, and the last chance was when I passed. There are other alternatives. There is a PLAB. You've got the WBA. You've got the New Zealand exams. So if you're not in the mindset, I know there are lots of doctors out there who've got PTSD from the exams, who have died, clinical signs of PTSD and depression and anxiety from the exams. Very common. Go get help. I got help. Go get, even because there's a lot of cultural stigma about getting therapy or getting the help you need or the antidepressants or the anti-anxiety medications. You don't need to worry. You need to get the help that you need. You need to believe in yourself and you need to push through. And then, you were saying if there's someone who wants to do ENT or ONG, it's not impossible. If you're ready to fight, in the sense, when I say fight, I'm not talking about a battle. I'm talking about putting yourself out there, meeting people, going to conferences. People need to know you as a person, as a doctor, as someone who's willing to go against all odds rather than a name in an application. If you want something like ENT or urology or orthopedics, they need to, that there's one thing, this quote that I read the other day, which really stuck to me. Be so good that they can't ignore you, right? Be so good, and this says, I'm not talking about, oh, you're a gifted doctor or anything. It's about your perseverance and determination that actually catches the eye of all these governing boards. They want to see that you've got that passion, you've got that in you. It's more than the capability. I think that's what they want to see. So go out there, you know, market yourself, put yourself out there. Show them that there's no one else better than you that they can hire or, get into the program. That's my advice. You need to believe in yourself because no one's going to believe in you if you don't believe in yourself. It's never happening.
Man, I almost am, am jealous for your children. Like, they've got you as a mom, like super inspiring and everything. Like, it's
Thank you. That's really kind of you to say because I was reading this book. It's called The Grit. I don't know. It's by Angela Duckworth. Phenomenal book. I think it talks about how she did the study on. She's a psychologist who was studying the traits of achievers, of people who beat the odds and succeed in life. And it had nothing to do with their born abilities or giftedness or how people talk about it. It's such a misconception. It's about your ability to fall, get up, dust yourself off, and go, I'm ready for another fight. Let's go. You know, it's the grit. It's any success story that you listen to. There's one common factor, and that would be the resilience and the grit. That's what I teach them. I said you can be brilliant at whatever you do, or you could be very good at what you could be gifted at, born gifted. But if you don't do anything about it, you're not going to get anywhere, isn't it? Especially with my son when he does taekwondo. That's what I tell him. You lose, you win a few, you lose a few. That's fine, but you just need to get up and keep moving. You can't sit there being feeling sorry for yourself and wallowing in your misery, and you're not going to get anywhere.
I couldn't agree more, Ange. It's been awesome having a chat to you. I think it's like super interesting to actually see like how passionate you are about all this stuff. I mean, it seems like you actually provide help to like IMGs who are before like their part two clinical.
Oh, definitely. I'm happy for anyone to reach out to me and in ask for help or advice, or if you just need someone to just listen to you. If you just need someone to be there when you're struggling and all you want to do is to cry your heart out or vent. I'm there because I know how hard it is. I know how hard it is, and I know how lonely it can get when you've left your family, you've left your friends, you've left your hometown, you're in this unfamiliar environment and you have no one to talk to. So if I'm more than happy if any IMGs or any doctors who want to reach out and they want any help. I'm here. I'm always here.
Easy. Well, we'll put some of your contact details in the description if you're comfortable with that. Um,
Oh yeah, I'm happy with that.
we might wrap it up there, Ange. But best of luck with all the BPT stuff.
Thanks, Harry. You stay in touch, yeah. All the best with your application and all that. So good to see and talk to you after so long. Thank you for this opportunity. It was so much fun.
No worries. It was awesome. Alrighty. Alright, so that's the end of that conversation. If you want to be part of something like this, you think you have an interesting story in medicine to share, maybe it's how you got in, and maybe it's that you got on a different training program or you went through some adversity, that's something that you think you'd be interested in doing, then send me a message. The link will be in the description how you can get in touch. If you know someone else that's probably keen to share their story or you think that they would be a great person to share on this, then definitely link them in and we can get them on. If you want to stick around, there's plenty of other videos on here to check out and keep you informed, keep you interested, and keep you learning more about medicine. So there you go. Otherwise, we'll see you next time. Bye.